We start with BC's Omicron strategy laid bare. The onus now on businesses to prepare for massive staffing shortages as cases climb and more people end up in the hospital.
With other provinces tightening restrictions to slow that spread, Dr. Bonnie Henry refusing to do so today. CTV's David Molko joins us live now with more on this tonight. So David, Dr. Henry really relying on all of us today to do the right thing because she says she does not want to impose any new orders.
And what she said, and I'm going to be unusually blunt here, left a lot of folks, including me, surprised. Remember, she is the top doctor. She makes the orders. And today, there weren't any.
Now's the time that we have to prepare.
And prepare we must, she says, with up to 1/3 of workers forecast to catch Omicron, potentially all at once.
It's not about public health orders and us telling you what to do. I've said many, many times that I want to get out of the order business.
That means no new orders despite thousands of cases a day, but a call for businesses to restart their COVID safety plans. So we asked.
With respect, you're the provincial health officer. When you say, I want to get out of the order business, my jaw just hit the ground. I'll make the leap and say I'm not really the only one. So we're seeing more orders in places like Ontario, indoor dining closed, Quebec, a curfew, Manitoba just announced further school start delays, I think another week or two. So respectfully, help me pick my jaw up. Why isn't that, in your view, the path for us in British Columbia?
Yes, from the very beginning, public health orders are there as a last resort when we want to make sure that people are absolutely doing things, and we want to do them in what we call the least restrictive means. What are our goals of our pandemic response? And, primary is to prevent serious illness, to prevent sickness and death, to prevent overwhelming of our healthcare system. And thirdly, and really importantly, it's to minimize societal disruption. We don't have to force people to close to be able to get people to do the right thing.
I really am a bit of a loss of words.
Retired and respected ER physician Dr. Lynn Fiatro simply stunned.
I was flabbergasted. What is your job then? And are we going to let industry decide what they can and cannot do during a pandemic?
I think there's lots of time to second guess things in the future, but we take every decision looking at the data that we have in front of us today.
Well, so David, we know places like Ontario are essentially in lockdown mode. So is Dr. Henry ruling out more orders in the future?
Yeah, no, the short answer is no, but it's hard to know exactly what number of hospitalizations actually would trigger more orders. But speaking of those numbers, let's also take a look. There it is. Just over 2,500 new cases in the last 24 hours. Though keep in mind, the true number is likely much, much higher because we are at our PCR testing max. People doing rapid tests likely are not reporting their results. Okay, unfortunately, also 4 new deaths, that number in the last 4 days here. Here's what we really need to watch, though. Hospitalizations, they have jumped. You see it at the end, 35% since New Year's Eve. 298 people in hospital now with COVID-19, 86 people in intensive care. That is a number our system can handle, at least for now. And that is the big worry here tonight and for the weeks ahead, guys.
All right, thank you, David.